Hello and welcome to Healthy India. I'm Lottie Alaric. I'm back with you once again to take you on this journey of good health in the next 1 hour. As we all know that Indian healthcare is progressing day by day. With all the technical advancement and the scientific advancement, we see India touching new levels. So today in this edition of Healthy India, we will be talking about something really new and something which is very beneficial for mankind. Yes, we are going to talk about robotic surgery and its future in India. So to tell you more on the issue, I have in the studio an eminent panel of guests. It is my privilege to welcome Dr. Sudhir Srivastav, who is the chairman at the International College of Robotic Surgery, New Delhi. And sitting to his right is Dr. Anand Kumar, Director of Urology and Kidney Transplantation at the Fortis Group of Hospitals. And to my left is Mrs. Saroj Srivastav, who has had a robotic surgery performed on her, and she's sitting hale and hearty with us. So I take this opportunity of welcoming all three of you to the show.
Thank you.
Well, friends, before we start talking about the subject and before I invite you to ask your questions, let us all take a look at this report about robotic surgery.
Robotic surgery, computer-assisted surgery, and robot-assisted surgery are terms for various technological developments that are currently developed to support a range of surgical procedures. It was developed to overcome limitations of minimally invasive surgery. Instead of directly moving the instruments, the surgeon uses a computer console to manipulate the instruments attached to multiple robot arms. The computer translates the surgeon's movements, which are then carried out on the patient by the robot. Other features of the robotic system include an integrated tremor filter and the ability for scaling of movements. It is the newest addition to the surgical armamentarium. Robotic surgery provides the surgeon as well as the patient maximum comfort and ergonomics. Because of high level of precision, error rates are extremely negligible. Also, robotic instruments can access hard-to-reach areas of your body more easily through smaller incisions compared to traditional open and laparoscopic surgery. Robotic surgery is being extensively used in surgery of the prostate, uterus, rectum, esophagus, etc., with excellent results and drastically reduced hospital stay for the patient. India has about 12 to 15 robots at the moment, and the numbers are likely to multiply rapidly in the coming months. Robotic surgery is becoming increasingly popular in India.
Well, as the report said, that robotic surgery is becoming popular in India, but I'm sure there is a large part of the society which may not really know about this. So this is what exactly we are trying to find out today. So Dr. Srivastav, let me begin with you. When we say robotic surgery, can you just simplify this a little bit for us as to what would it mean in layman parlance?
So robotic surgery is partly a misnomer in the sense that our general impression of the robot is we see a machine picking up things and putting them, manufacturing cars, and many other industrial robots are there. But in medicine, the robotic surgery literally means it is a tool for the surgeon, which allows us to do these operations much, much less invasively with tremendous precision. So essentially, surgeon is controlling these robotic arms at all times, and in fact, surgeon is operating utilizing the robotic arms. So the main thing is it allows us, when I operate normally, for instance, I use my eyes to see 3D vision. I use my hands to operate. So the camera in the robot acts as the extension of the human eyes, gives a beautiful 3D magnified view up to 10 times, which is better than human eyes. Then the instrument arms of the robot are extensions of my arms. So I can sit away from the machine, put these arms in the patient's chest or other surgeons in the abdominal cavity, and literally sitting away from the patient, looking into a 3D, control those robotic arms very precisely. The tips of these instruments behave like human wrist. In fact, they have more degrees of freedom than human wrist. So all of this translates into essentially operating through very tiny incisions with much less trauma, while allowing us to do very complex operations. But the myth is always that want to be very clear that robot is not doing anything on its own. It's
Correct.
a surgeon operating.
Correct. So which means that there's more precision to the whole procedure.
That's correct.
Right. So, Dr. Anand, if I were to ask you as to, because one just keeps hearing about a term like this, but when did India really begin robotic surgeries?
I think it started around 2003.
So which means it's very recent.
Yeah.
Yes.
So the first robot was came in All-India Institute, then Scott Hart. And heart surgery was done in Scott Hart. And urology was started in All-India Institute of Medical Sciences. And then next one was the Scott Hart Hospital, which is now the Fortis group of the hospital. And then mainly the development occurred in Delhi only. There was one robot in Hyderabad which didn't function. And then slowly now the things started moving in 2010 onward.
Okay, okay.
So now there are around 14, 15 robots all over the country.
Okay. But what I would want to know is that when this came into India for the first time, so were the doctors at all skeptical about this whole
I think
thing?
first cardiac surgery was
In fact,
done by
if I may
Dr.
interject, Lottie,
Yes.
because I was the first surgeon ever to have done robotic surgery back in 2002, and I still remember December, and President Abdul Kalam was inaugurating the Escorts Hospital expansion. So we did the first case there in December of 2002. And since then, it is gradually progressing. In the last 2 or 3 years, there is literally an explosion now. And I think for a variety of reasons, more surgeons are interested, more surgeons are able to do, patients are becoming more aware, technology has come long ways, people are past their learning curve. So all of this has changed the scene in India.
But I would also want to know that we still don't have that many surgeons performing robotic surgery. So how does the medical fraternity really look at this? Do you find doctors coming up, you know, and wanting to be trained for robotic surgery?
Yeah, sure. It's like anything in medicine, and if I was to give you an example, any revolution that occurs in medicine, based on the statistics, it literally takes 17 years, which seems like a long time, but for everybody to truly adopt. So then you have early adopters, you have pioneers, then those pioneers teach others, and so on. So just to give you a comparison, in the United States, this started back in 2000.
Right.
Today, they have 1,000 robotic systems. Last year, they did 250,000 robotic surgeries in US in various specialties. Currently, we have in India, let's say 14 robots, doing less than 1,000 surgeries. So when we look at this thing, so there's a huge opportunity in India. And if you take the paying population base, in US, there are about 300 million people. We have upper, middle, and middle class. Similar range, our economy is improving, our penetration of insurance is going to increase. So I think when we look at this thing, as more and more surgeons train, more patients will benefit. And it's just like what I routinely say, it's like the laparoscopic surgery revolution.
Right. Right.
Laparoscopic surgery started back in the 80s. There was a lot of skepticism. You know, again, in medicine, people are traditional. The surgeons, they're trained in certain ways. So they want to continue to do what they got trained, and they feel comfortable.
Right.
And it takes time to change. But today, if you look at the laparoscopic surgery, that anybody who can have laparoscopic surgery will have it. They do not want large incisions.
That's right.
And there are many, many surgeons today in India who are doing laparoscopic great work. So I think here we are going to see the same revolution in robotic surgery through very organized teaching and training efforts. I think this will change.
Right. Well, before I go to Mrs. Saroj, I would definitely want to know a lot about which robotic surgery did you really opt for. But all that will come after this very short break, as it is time for us to slip into this break. But people do come back quickly, as today we are talking about a very advanced form of surgery called the robotic surgery. So do stay tuned. Welcome back. You're watching Healthy India, and today we are telling you all about robotic surgery and its future in India. So if you want to know anything about robotic surgery, this is your time to ask those questions. All you'll have to do is pick up your phone and reach us at 1800115314 or 23035420. My only request to you, as always, to keep the volume of your TV set to the bare minimum and to listen to us only through your phones. Otherwise, I'm afraid I will not be able to entertain your calls. So remember the numbers, which are 1800115314 and 23035420. Robotic surgery is the focus of our discussion today. Now we have with us Mrs. Saroj Srivastav, and I presume that you have had a robotic surgery.
Yes.
And for what condition did you really need this surgery?
I had blockage in my main vessel,
Okay.
and there was another also. One was fully blocked and another was getting blocked.
Okay.
So in that situation, and I was quite tired. I mean, I used to feel very tired. And in that situation, when I found out that, and this is the problem with me, somehow I had gone to the doctor and consulted and found out that I'm having this kind of a problem. So I took medicines for 5-6 months, but my condition wasn't very much improved. So then I thought that why to take any kind of a risk. And when I came to know about the robotic surgery, then I thought that, okay, and not only me, means that we had the discussion in our family.
Right.
And then we all decided to go about it because there is no point in taking any kind of risk unnecessarily. The ailment is not going by itself with the help of medicine. That's what I want to say.
Right.
Then, and the surgery is the ultimate answer.
True.
Any kind of surgery,
Yeah.
I mean, whether it is stent or any kind
Yes,
of thing. If that is the answer, then why not? Then why not go for the best? So that is what we thought. And that is what
So were
I
you ever
opted for.
apprehensive in the beginning when they told you that this is an option that you can exercise? So were you ever, scared about the fact that you will have a robotic surgery?
No. First of all, that I think that it is, I mean, when we are going to contact a very renowned surgeon who has already got so much of experience and
Right.
doing every now and then all the surgeries about it, why should I get worried about it?
Oh, great.
There was
So I
no
think the
point in
compliments to
getting
your
worried.
surgeon on this one. Well, right now we are joined by Mr. J.N. Rao from Maharashtra. So, Mr. Rao, if you're there with me, welcome to the show.
Thank you.
Yeah,
My
please.
question
Yes.
is robotic surgery system applicable to varicose veins in its treatment also?
Okay, to varicose veins and its treatments. So, would you like to answer that?
Any operation can be done, but it is not necessary to do varicose vein surgery with the robot. Veins slide superficially, and any other prevalent technique can treat it. Robot will add to expense, and it's really not necessary to do varicose veins with the robot.
Right. Well, so that's the answer, Mr. Rao. And well, now, Dr. Anand, is there a special kind of training that is required for surgeons to perform robotic surgery? If yes, then what is this specialized training all about?
Yeah, everything you have to do new, you have to train it because we are going to operate on human being.
Correct.
So there is a structured training program. Like I went to Strasbourg. So first you have, they explain you about the machine. They let you touch the machine, let you move the machine and change the instrument and everything. When you understand, then they do you to the dry lab. You let you perform some simpler procedures. And when they see that you are okay with that, then they let you operate on pigs. So that there is operation theater where pig is anesthetized, and you start doing the kidney operation on pigs and intestine operation on the pigs.
It's almost like going back to college.
Yeah, and after that, once you know that you have got sufficient that, then they issue a certificate. And then that is also not enough. After that, once you have the basic things, you have to go and see to some other experts who are doing this operation daily. And then you know how the things are moving. You read about it, you discuss about it, you see their videos. And before you are going to do, you need to have a mentor who is going to take you through, because you are operating on human being.
That's right.
We are not supposed to commit a mistake. So it's not that you just see in a video and you start operating it. You have to properly train because somebody's life is involved.
Absolutely.
And then like some of the operations are very tricky. If you make a little mistake, then there will be bleeding and the whole field will start going and it may go wrong. So there has to be a certification, then there has to be mentoring, and then you have to keep on training. And any new procedure you do, there is always a learning curve. And that's why a lot of people are scared to do it. because the same operation you might take 4 to 6 hours to do it.
Right.
But after doing 40, 50 cases, you'll be doing 2-3 hours. After doing 100 cases, you'll be doing 2.5 hours. Maybe after 500, you'll finish in 1.5 hours. It is, learning never stops.
Learning never stops.
It keeps on moving it. And that's how the more experience you have, the better results you produce.
Absolutely. Well, I think this piece of information is definitely going to be encouraging for all those who are watching, that these are experienced surgeons and nobody will just operate on you just like that. They have a certification to it, which Dr. Anand just told us about. Well, now we have with us Mr. Paresh Panchal from Gujarat. So, Mr. Panchal, welcome to the show.
गुड इवनिंग गुजरात साबरकांठा के सटम्बा से परेश पंचाल बोल। रोबोटिक सर्जरी इंडिया के फ्यूचर के लिए हमने देखा बहुत अच्छी बात रहती है। साहब ने बताया अभी, डॉक्टर साहब ने, कि बहुत समय लगता है बहुत ऑपरेशन करने के अंदर, वो कम समय के अंदर भी किए जा सकते हैं और उसकी एक्यूरेसी भी इसमें अच्छी होती है। सिर्फ होना चाहिए, आपने बताया कि एजुकेटेड और सर्जन अच्छा होना चाहिए। अब मैं मानता हूं कि गांव के लोगों को ये रोबोटिक सर्जरी कितनी बेनिफिट करेगी और इसके लिए कहां हमारे भारत में अगर अवेलेबिलिटी हो सकती है वो, और कितना इसके पीछे खर्च होता होगा, क्या फायदा किन सर्जरियों में।
थैंक यू वेरी मच मिस्टर पंचाल, हम समझ गए आपका सवाल। एंड आई वुड लाइक टू रिक्वेस्ट डॉक्टर श्रीवास्तव टू टेल दिस टू अस फर्स्ट, दैट कितनी किस शहर में यहाँ पर हमारे यहाँ रोबोटिक सर्जरी अवेलेबल है पहले।
So NCR, that means Delhi, Gurgaon mainly, यहाँ पे करीब 7 या 8 रोबोटिक सिस्टम्स हैं। एस्कॉर्ट्स हॉस्पिटल, मेदांता, ऑल इंडिया इंस्टीट्यूट, एक लेप्रोस्कोपिक हॉस्पिटल है, राजीव गांधी कैंसर इंस्टीट्यूट, और दिल्ली के बाद में एक बॉम्बे में है, एक पुणे में है, हैदराबाद, चेन्नई, बेंगलोर। तो अभी इतने शहरों में हैं। और दूसरा आप बता रहे थे गांव वालों के लिए, तो अभी गांव वालों को तो शहर में आना पड़ेगा, क्योंकि ये मशीन काफी महंगी है। 8 करोड़ से 12 करोड़ तक की सिर्फ मशीन की कीमत है। फिर उसमें जो इंस्ट्रूमेंट्स यूज होते हैं वो भी महंगे हैं। पर ये बताएंगे, अभी हमने एक गांव से आया था, हरियाणा का फार्मर, उस पर बाईपास ऑपरेशन किया सिर्फ 4 छोटे छेदों से। 3 दिन बाद वो घर चला गया, चौथे दिन वो फार्म पे डंडा लेके खड़ा था। तो इससे तो बहुत फायदा है। तो गांव वालों को वो ऐसा नहीं सोचना चाहिए, क्योंकि इनफैक्ट फार्मर्स जो हैं, जो हार्ड वर्क करते हैं, उनको मैनुअल काम ज्यादा करना पड़ता है। तो बहुत अच्छी है। तो वैसे तो सब एज ग्रुप्स के लिए अच्छी है सर्जरी, क्योंकि रिकवरी बहुत ज्यादा होती है और ये धीरे धीरे फैल जाएगी। और अभी गांव तक तो ऐसे पहुंचेगी नहीं, क्योंकि ये कॉम्प्लेक्स ऑपरेशंस हैं, बहुत सारी टीम्स चाहिए, उसके साथ जो कीमत एसोसिएटेड है वो भी ज्यादा है। तो पर धीरे धीरे वो पेनिट्रेट हो जाएगी। पर इस समय
So if you talk of the cost, now if this machine is costing those many crores, so I'm sure these operations are pretty expensive.
Yeah.
Right?
So we are offering these operations. So what we have done, so there are, let's say, traditional packages of let's say heart surgery, for instance, 2.5 to 3 lakh rupees. So what we did, we added the cost of the consumables on the top of, because everything is imported and we have to pay for it to be able to even operate. So basically we have just added on the package price the additional cost of the consumable, which in many operations does get done. So if somebody is, let's say, even with conventional operation, will have a valve replacement. So they will charge that plus the cost of the valve.
Right.
So the same thing is there. So in fact, India does the surgery the cheapest way. In robotic field, one time I operated in Chicago on an Indian patient from here. They paid $70,000, while we are doing this operation equivalent of around $7,000 to $8,000. So there's a huge difference, and they get the best treatment locally with the best expertise.
Right. Well, I think all this information is pretty important for all of us, and the costs are also there. And as he has just explained this to us as to what do the costs really mean in India, well, so which means that the future of robotic surgery is pretty positive in India too. Well, time for us to slip into another break, but stay put, as we'll be back in just a moment. Welcome back. You're watching Healthy India, and today we are talking about robotic surgery and its future in India. So if you think that you would want the answer to some questions that are there in your mind regarding robotic surgery, this is your chance to ask those questions as you get your answers right here, right now, as I have two experts with me. And the numbers are 1800115314 and 23035420. We are talking about robotic surgeries today. Now, Dr. Anand, I'm sure the people who may have just tuned in or who've been watching us for quite some time, what they would want to know is that which all are the operations that can be performed with robotic surgery?
Yeah, in robotic surgery, like in urology, the one operation actually robot developed for that particular operation is the prostate surgery.
Right.
Because prostate is situated so deep in the lower part of the abdomen, even if when we used to do the operation, we never saw it so well. And when the surgeon is operating, only he can see, assistant cannot see. So some of the operation was quite blind.
Right.
So there used to be more bleeding. People used to bleed 1.5 liter, 1 liter, 2 liters of blood. Now, once this robotic surgery comes, you see so well that blood loss is now 100 ml, 200 ml.
That's all. Right.
And because you see everything, you control everything, you move so well. So the prostate surgery is basically has become like it is a must. If somebody say I can do laparoscopic, I can do open, but unless patient insist, I won't do it because it is good for the patient and good for me also. Because I see better, I do better.
Correct.
Same way that another operation which has taken up very well in urology is that partial nephrectomy. When somebody has a tumor in the kidney and you just remove the part of the tumor along with the little bit margin of the normal healthy tissue. So you save the kidney. Otherwise, if you have kidney tumor, we used to remove the whole kidney. But now it has shown there is no need to do all that. You just remove tumor. And with the robotic surgery, you can repair all the small vessels so well and so quickly that time, because it's a time-bound procedure, you have to finish within half an hour. And with that laparoscopic, it was not possible, used to take more time. But with robotic, since reconstruction and suturing is so well,
Yes.
it is done very fast. See, with my wrist, I can do only 6 time movements. With robotic, we can do 7 degree of movement. So robot can move better than my
That's
hand.
Right.
So that's why your suturing and is very precise, and you do it very fast also. The whatever way you want to do with the left hand, you can do with the left hand. You want to do right hand, you can do with the right hand.
So it's like magic, almost
Yeah,
like magic.
and then all the reconstructive procedures like cystectomy, bowel reconstruction, partial cystectomy, ureteric reimplantation, ureteric pyeloplasty, where you need a very precise, using very fine suture, 50, 60, which are difficult to even see with the normal eye. And with the robot, you can see them better. So you can do it very precise operation. Same way it has taken up very well in gynecology, removal of the uterus, doing the cancer operation of the uterus and ovary. Do the tuboplasty for the infertile woman, where the tube is very thin. But if you see 10 times better, use 10-0 suture, which you can't see with the normal eye, you can do a very precise job. Now in general surgery, they started doing colonic surgery, liver surgery, and same way Dr. Srivastava will tell about the heart surgery and thoracic
before I
surgery.
go to him, I have a viewer with me. This is Priyanka from Haryana. So Priyanka, can you hear me, please?
Yeah, ma'am.
Yeah, welcome to the show. And what's your question?
जी मैं ये पूछना चाहती हूँ कि ब्रेन की जो सर्जरी होती है उसमें रोबोटिक सर्जरी कैसे यूजफुल होती है, और ट्विंस जैसे होते हैं तो कई बार जुड़े हुए बच्चे पैदा हो जाते हैं अब नॉर्मल, तो उसके लिए ये कैसे कारगर साबित हो प्रेगनेंसी के वक्त जो रिस्क होता है.
Right. Thank you for the question. So she is asking two questions here. That is it possible for any kind of brain surgeries or head surgeries, and also for any Siamese twins, can they be separated through robotic surgery?
Not at this time.
Right.
Answer is no to both the questions.
Okay.
Yes.
Okay. So so let's now hear a little bit about the heart surgery as to this is one area where it has made a lot of foray into it.
Sure. Yeah, that's my expertise, and I just love it that we are able to do very complex heart operations. Literally all of them now through 4 or 5 fingertip size incisions. So bypass surgery, single, multiple bypasses, valve repair, replacement for all valves, tumors of the heart, congenital defects, atrial septal defect, ventricular septal defect, then any irregular heart rhythms, and then anything that is in the chest, lung operations, esophageal operations, thymus, any tumor. So all of these operations in the chest now can be done with the robotic assistance.
Great. Well, I think that's a very, very encouraging news that we are just listening to today all about robotic surgery. And if you still have a question, do call us quickly. And right now we are joined by Mr. Harjeet Singh from Delhi. So, Mr. Singh, welcome to the show.
Thank you, thank you.
Ji.
As you said, robotic surgery is a new field in medical fraternity in India and is here to stay. My question is for Dr. Srivastava.
Right.
That is there any group of patients or diseases which for them robotic surgery is a big no-no? Thank you.
Is there anything for which robotic surgery is a big no-no? Okay.
So heart transplants
Right.
will be a big no-no. Any complex reoperations requiring a lot of things done to the heart, it will be a no-no. Patients who have had lung operation, whereby there's a lot of scar tissue from prior operation, because we need working space, so we cannot do that. But I think other than that, in experienced hands, most operations can be done today.
Right. Well, let me come to you, Mrs. Saroj, once again. So once you were operated upon your heart, you know, with this robotic surgery, how many days did it take for you to actually get discharged from the hospital?
Oh, it was 3 days I was in the hospital. And third day I was even started walking. I was supposed to walk for whatever, I mean, little while. So after 3 days I was discharged, and I will say that next 5 days I was on the bed in my home.
Right.
And after a review of, after 8 days, there was a review. So I had gone and I commuted from Gurgaon to Delhi and came and saw the doctor. So afterwards,
So how long did it take for you for your normal life, you know, to continue with your normal life?
Good question. It was exactly, I found out that 3 weeks were the most. 3 weeks I had observed everything, and I must tell you at this point that I'm a diabetic person also. I have got hypertension medicines also I'm taking. So, and thyroid problem.
Oh, okay.
All the three problems.
Right.
Somehow
you didn't leave anything out.
I landed with this. So, however, after 3 weeks, I was able to come to Delhi and come to my regular, commute so much. And I started there after 4 weeks, my normal life. Yes.
Right. Well, I think that's really good. And now we have with us Shankar Sudhar from Rajasthan. So, Shankar, can you hear me, please?
Yes, madam. मैं
Yeah.
पूछना चाहता हूँ
जी
तुमको कि वैसे मेरा काम भी मेडिकल प्रोफेशन से जुड़ा हुआ है
जी
मैं जानना चाहता हूँ कि ये जो रोबोटिक सर्जरी के द्वारा जो अपन परंपरागत सर्जरी में गाल स्टोन को हटाया जाता है ना गाल ब्लेडर को ही हटा दिया जाता है
जी
तो क्या गाल स्टोन को पर्टिकुलरली हटा करके अपन गाल ब्लेडर को सुरक्षित रख सकते हैं?
That's a good question, I think, and let Dr. Anand.
This, see, when the gallstone is there in the gallbladder, whole gallbladder
Well,
is
I'm
diseased.
sorry, I'll have to interrupt you just for a moment, and it's time for us to slip into another break. When we come back, we are going to come back with this answer. So don't go away, as we'll be back in just a moment. Welcome back. This is Healthy India, and today we are talking about robotic surgery and its future in India. Before we went into the break, we had Shankar Sudhar with us from Rajasthan, who wanted to know that whether through robotic surgery you can just remove the stones and leave the bladder. So what is your answer to him?
उस ऑपरेशन का कोई फायदा नहीं, क्योंकि अगर हम केवल गाल ब्लेडर से स्टोन निकाल करके गाल ब्लेडर को अगर छोड़ दें तो गाल ब्लेडर में फिर स्टोन बन जाएगा और वो डिजीज गाल ब्लेडर रहेगा. तो इसलिए मेडिकल में देखा गया है कि गाल ब्लेडर को छोड़ने का कोई फायदा नहीं है. इट इज बेटर गाल ब्लेडर को निकाल दें, उसी से पेशेंट को फायदा होता है.
Right. Well, Dr. Srivastava, now I would want you to touch a little bit upon the fact that when will the cost really come down of robotic surgeries, and what is the real future of robotic surgery that you see in India?
So, like any other technology, so right now, there is only one company in the world, so they have monopoly to dictate the prices. So the cost of the technology initially is always high because a lot of money they spent on research and development, so they try to recover.
Right.
So to my knowledge, as we are speaking, there are 4 other robotic companies in the world that are coming up. what it will do, it will create competition. Hopefully the prices will come down. And as the demand increases, just like the cell phone technology.
Right.
When it got introduced, everything was expensive, these wonderful high definition televisions. So just like that, as more and more people utilize it, it's a consumer oriented thing in the end, and yes, the cost will definitely come down. So what I see as far as the future in India is concerned, first of all, the cost is not exorbitant in relation to huge benefits that the robotic surgery offers. So that is one thing. Secondly, a lot of these complex operations which will require larger incisions or are not possible with laparoscopy now can be done through little holes.
Right.
So recovery is very, very different. I think our economy is growing. There will be more insurance penetration, and as we create a track record, more surgeons do. I think the insurance system will start to pay. Currently, insurances are paying.
Right.
And we truly hope one day our government, CGHS and other agencies will in fact approve and start paying for this, because this will certainly offer to more and more people in our country.
Right.
And I think as the technology costs come down, definitely more and more people will be able to afford it.
That's right. Now, finally, Dr. Anand, just tell us very quickly as to are there any training centers that are coming up in India for robotic surgeons?
Yeah, there is one training center in Gurgaon, and there is another one is going to be started in Chennai. So these are the two places where people can go and get the training.
Right. And finally, Mrs. Saroj, just tell us as to, after you finish with this operation, you must have had a lot of people to come and ask you, and was that treated as an encouraging point for those people? After your operation, did you get many people to say that, okay, now I'm going to opt for robotic surgery?
इसके infection वगैरह के डर से you just cannot you would not like that other people should come just like that on next day.
Right.
But when I was able to move out from my bed, and all that was after say 3 to 4 weeks, जब मैं बाहर निकली तो मैंने, of course, I talked to the people around, मेरे friends वगैरह, सब लोगों से मिले. Everybody wanted to know कि कौन सा आपका operation हुआ.
Absolutely, and I'm sure even today as you're speaking, the people who are watching must really be very positive about robotic surgery.
मैंने उनको बताया कि मेरी क्या सर्जरी हुई. कभी कुछ लोग नहीं भी समझ पाए कि इतनी जल्दी आपकी हार्ट सर्जरी हो गई, एंड हाउ कम आप एकदम से बाहर भी निकल आई और यहाँ भी जा रही. एंड आई टेल यू कि मैं कुछ 6 वीक्स के बाद से मैं यूके, यूएसए और कहाँ मुझे जाना, मतलब कुछ ऐसा हुआ जीवन में that I had to go somewhere.
We are running short of time, ma'am. I really wish we could talk to you a little more. And finally, I think I would want the viewers to know as to what are the benefits of this robotic surgery, and also take a recap of what all we've discussed so far. So do take a look.
Types of robotic surgery: supervisory controlled systems, telesurgical systems, shared control systems, robotic radiosurgery systems. Benefits for the patients: reduced trauma to the body, less anesthesia, often less blood loss and need for transfusions, less post-operative pain and discomfort, less risk of infection, shorter hospital stay, faster recovery and return to normal daily activities, less scarring and improved cosmesis. Benefits for the surgeons: enhanced 3D visualization, improved dexterity, greater surgical precision, improved access, increased range of movement, reproducibility, simplifies many existing MIS surgical techniques, makes difficult MIS operations routine, makes new MIS procedures possible in most surgical specialties.
Well, the benefits are immense, as you all must have seen. And as I see it, I think the future of robotic surgery is very bright in our country. Well, before we go, I'd like to tell you that please keep writing into us and telling us as to what you feel about these episodes, and especially what you feel about robotic surgery. For that, you need to write to me on this address.
Healthy India, FB 116, Lok Sabha Television, Parliament Library Building, Parliament House, New Delhi 110001. Email healthlstv@gmail.com, and our toll-free number is 1800 115314.
Well, I'd like to say thank you to you, Dr. Srivastava, Dr. Anand and Mrs. Saroj for coming today and for talking about robotic surgery and for enlightening us with all the news that you've given us about robotic surgery.
Thank you very much.
Well, people, I do hope that you must have benefited a great deal from today's episode as we've all learned new things about robotic surgery, and definitely this is going to be the future in medicine very soon. Well, that's all we have for you in this edition of Healthy India. Join me next week for something equally informative and engaging. Till then, this is Lottie Alaric saying goodbye and take very good care of your health.